My name's Melina Georgousakis, and I'm a research scientist by training, actually. But I'm now the founding director of a social enterprise called Franklin Women, and we're all about connecting and lifting up women working in healthcare and medical research. I started it, like you said, 9 years ago, and it was really just born out of a personal need. I'm a medical research scientist, like I mentioned, so I just finished my first postdoc. I had these really strong ambitions to make a difference to health. I wanted an academic career. I wanted to kick the goals that I saw my supervisors doing. But as I started progressing, I realized that there was a few barriers that I was hitting, and the experience for me wasn't the same as some of my peers, particularly my male colleagues. And I realized it had not much to do with me and my capabilities and my skills. It had more to do with my gender. So I started Franklin Women to basically connect other women, provide them professional development and support, and start breaking down some of those barriers at a systems level so that we can thrive in our careers. Community is important, and I really lead that Franklin Women is a community, but it's the thing that's hardest for others to grapple with what it means, and it's kind of a bit of a wafty word. It's a sense of belonging. And I think our sector can be really fragmented. We have different disciplines. We have hierarchy. So you're a student, and then you're, a professor, and different layers in between. And because of that fragmentation, we don't feel like we are connected. And it means that we don't break down silos, we don't collaborate, we don't seek different perspectives, and also we don't bring our whole person to the table. So creating a community is special. And Franklin Women's done that. It means anyone can turn up. You can be at a Franklin Women event and have a PhD supervisor hanging out with an institute director, talking about their greatest wins in life, but also they've got a kid at home sick and they don't know where to get the Panadol so they can get home. That is really special, and I think it has been why we've achieved what we have. You can say that you're a network or that you're a community, but it's not about the word, it's about the feeling and the sense that you get, and I think that's what we've nailed. One of the initiatives we run is a cross-organisational mentoring program, and it's specifically targeted at mid-career women, because in health, that's where they stagnate or they get lost from our sector. And we actually connect them with leaders of all genders. So it's a program to support women, but mentors are of all genders. And what that means is all of the leaders in our sector understand the challenges that women are going through, but also they learn about that diversity and inclusive leadership that they talk about, so that they don't just support these women, they then go back to their organisations and change how they lead their teams. And I think that that's what's made this initiative really impactful, and something that I hope to talk about today. Our community is super diverse. So we have individual members that are sitting at around 500, and they pay to be part of Franklin Women and get lots of perks. But our community is more than 10,000. So we have women who come to our events, take part in our mentoring program. We have this super engaged following on social media, and that's really about visibility and lifting up women in STEM. So the ripple effect of the women that we've touched is really massive, and I actually think you can't put a number to it because the support that one person gets, it's lifting up someone else, and that ripple pays it forward long after that individual.